Nursing homes that were at the epicenter of the COVID-19 pandemic at the start, they largely have their cases under control, yet they're facing a new challenge: how to stay financially stable in this new environment. Our Mark Salinger continues his reporting on how nursing homes are navigating COVID-19.
Nursing homes are now fighting two battles: a virus and their bank account. The facilities have had to invest a lot more money into securing personal protective equipment to keep employees and residents safe. They've also had to pay employees overtime and bonuses for working through the pandemic. On top of that, the number of residents living inside these facilities has dropped sharply.
When they start to see a decrease in the number of people that they care for, and therefore their revenue, they have to make some very difficult choices about.
Doug Farmer is the president of the Colorado Healthcare Association, representing senior care centers across the state. He estimates the number of residents living inside nursing homes has decreased between 15 and 40% in some places.
I think people are waiting to make sure that things have leveled out, to see if there's a vaccine.
Let's go up north and take a look at the Estes Park Health Living Center. The facility has 52 licensed beds. Right now, it says less than half are occupied. It expects to lose $1.4 million this year, about $56,000 for each empty bed. The financial strain brought on by the pandemic has forced the owners to propose closing the facility entirely. About 55% of all nursing homes around the country report operating at a loss this year, according to a survey by the American Healthcare Association.
If we don't start to see things turn around with the number of people who are availing themselves of long-term care, that will be the financial struggle that they'll have to reckon with.
Even with the pandemic still taking lives, nursing homes now struggle to keep the doors open. For Next, I'm Mark Salinger.
Estes Park Living Center still looking for options to avoid closing. If they are forced to close, residents would have to move somewhere, and many of them likely outside of Estes Park.